Nursing process, the patient with pneumonia. Assessment. Nursing assessment is critical in detecting pneumonia. A fever, chills, or night sweats in a patient who also has respiratory symptoms should alert the nurse to the possibility of bacterial pneumonia. A respiratory assessment will further identify the clinical manifestations of pneumonia. Pleuritic type pain, fatigue, tachypnea, use of accessory muscles for breathing, bradycardia or relative bradycardia, coughing, and purulent sputum. It is important to identify the severity, location, and cause of the chest pain. Along with any medications or procedures that provide relief, the nurse should monitor the following. First one, changes in temperature and pulse. Second, amount, odor and color of secretions. Third, frequency and severity of cough. Fourth, degree of tachypnea or shortness of breath. Fifth, changes in physical assessment findings, primarily assessed by inspecting and auscultating the chest. Sixth, changes in the chest X-ray findings. In addition, it is important to assess the elderly patient for unusual behavior, altered mental status, dehydration, excessive fatigue, and concomitant heart failure. Diagnosis. Nursing diagnosis based on the assessment data. Major nursing diagnosis may include A. Ineffective airway clearance related to copious tracheobronchial secretions. B. Activity intolerance related to impaired respiratory function. C. Risk for deficient fluid volume related to fever and dyspnea. D. Imbalanced nutrition less than body requirements. E. Deficient knowledge about the treatment regime and preventive health measures. The potential complications are 1. Continuing symptoms after initiation of therapy. 2. Shock. 3. Respiratory failure. 4. atelectasis. 5. Pleural effusion. 6. Confusion. 7. Superinfection. Planning and goals. The major goals for the patient may include improved airway patency, rest to conserve energy, maintenance of proper liquid volume, maintenance of adequate nutrition, and understanding of the treatment protocol and preventive measures, and absence of complications. Nursing interventions. First one, improving airway patency. Removing secretion is important because retained secretions interfere with gas exchange and may slow recovery. The nurse encourages hydration 2 to 3 liters per day because adequate hydration thins and loosens pulmonary secretions. Humidification may be used to loosen secretions and improve ventilation. A high humidity face mask delivers warm, humidified air to the tracheobronchial tree, helps to liquefy secretions, and relieves tracheobronchial irritation. Coughing can be initiated either voluntarily or by reflex. Lung expansion maneuvers such as deep breathing with an incentive spirometer may induce a cough. A directed cough may be necessary to improve airway patency. The nurse encourages the patient to perform an effective directed cough, which includes correct positioning, a deep inspiratory maneuver, glottic closure, contraction of the expiratory muscles against the closed glottis, sudden glottic opening, and an explosive expiration. In some cases, the nurse may assist the patient by placing both hands on the patient's lower rib cage anteriorly or posteriorly To focus the patient on a slow, deep breath and then manually assisting the patient by applying external pressure during the expiratory phase. Indications for chest physiotherapy. In indication for chest physiotherapy include sputum retention not responsive to spontaneous or directed cough, a history of pulmonary problems, previously treated with chest physiotherapy, continued evidence of retained secretions, abnormal chest X-ray findings, consistent with atelectasis or infiltrates, deterioration in oxygenation. The patient is placed in proper position to drain the involved lung segments, and then the chest is percussed and vibrated either manually or with a mechanical percussor. After each position change, the nurse encourages the patient to breathe deeply and cough. If the patient is too weak to cough efficiently, the nurse may need to remove the mucus by nasotracheal suctioning. It may take time for secretions to mobilize and move into the central airways for expectoration. Thus, it is important for the nurse to monitor the patient for cough and sputum production after the completion of chest physiotherapy. The nurse administers and titrates oxygen therapy as prescribed. The effectiveness of oxygen therapy is monitored by improvement in clinical signs and symptoms, and adequate oxygenation values measured by pulse oximetry or arterial blood gases. Second one, promoting rest and conserving energy. The nurse encourages the debilitated patient to rest and avoid overexertion and possible exacerbation of symptoms. The patient should assume a comfortable position to promote rest and breathing. Example, semi-fowler position. He should change positions frequently to enhance secretion, clearance and ventilation or perfusion in the lungs. It is important to instruct outpatients not to overexert themselves and to engage in only moderate activity during the initial phases of treatment. Third one, promoting fluid intake. The respiratory rate of the patient with pneumonia increases because of the increased workload imposed by labored breathing and fever. An increased respiratory rate leads to an increase in insensible fluid loss during exhalation and can lead to dehydration. Therefore, it is important to encourage increased fluid intake at least 2 liters per day unless contraindicated. Fourth one, maintaining nutrition. Patients with shortness of breath and fatigue often have a decreased appetite and will take only fluids. Fluids with electrolytes may help to provide fluid, calories and electrolytes. Other nutritionally enriched drinks or shakes may be helpful. In addition, fluids and nutrients may be administered intravenously if necessary. Fifth one, promoting the patient's knowledge. The patient and family are instructed about the cause of pneumonia, management of symptoms of pneumonia, and the need for follow-up. The patient also needs information about factors that may have contributed or developing pneumonia or strategies to promote recovery and to prevent recurrence. Explanations need to be given simply in language that the patient can understand. If possible, written instructions and information should be provided. Because of the severity of symptoms, the patient may require that instructions and explanations be repeated several times. Sixth one, monitoring and managing potential complications. Continuing symptoms after initiation of therapy. Patients usually begin to respond to treatment within 24 to 48 hours After antibiotic therapy is initiated, the patient is observed for response to antibiotic therapy. Monitor vital signs and SpO2. In addition to monitoring for continuing symptoms of pneumonia, the nurse also monitors for other complications such as shock and multisystem failure, atelectasis, pleural effusion, and superinfection, which may develop during the first few days of antibiotic treatment. 7. Shock and respiratory failure. The nurse assesses for signs and symptoms of shock and respiratory failure by evaluating the patient's vital signs, pulse oximetry values, and hemodynamic monitoring parameters. The nurse reports signs of deteriorating patient status and assists in administering intravenous fluids and medications prescribed to combat shock. Intubation and mechanical ventilation may be required if respiratory failure occurs. Next, atelectasis and pleural effusion. The patient is assessed for atelectasis and preventive measures are initiated to prevent its development. If pleural effusion develops and thoracentesis is performed to remove fluid, the nurse assists in the procedure and explains it to the patient. After thoracentesis, the nurse monitors the patient for pneumothorax and recurrence of pleural effusion. Superinfection. The patient is monitored for manifestations of superinfection. Example, minimal improvement in signs and symptoms, rise in temperature with increasing cough, increasing fremitus, and adventitious breath sounds on auscultation of the lungs. These signs are reported and the nurse assists in implementing therapy to treat superinfection. Confusion. The patient with pneumonia is assessed for confusion and other more subtle changes in cognitive status. Confusion and changes in cognitive status resulting from pneumonia are poor prognosis signs. Confusion may be related to hypoxemia, fever, dehydration, sleep deprivation, or developing sepsis. The patient's underlying comorbid conditions may also play a part in the development of confusion. Addressing the underlying factors and ensuring the patient's safety are important nursing interventions. Promoting home and community-based care. Teaching patient self-care. Patient education is crucial regardless of the setting. After the fever subsides, the patient may gradually increase activities. Fatigue and weakness may be prolonged after pneumonia, especially in the elderly. The nurse encourages breathing exercise to promote secretion clearance and volume expansion. The nurse encourages the patient to stop smoking. Smoking inhibits tracheobronchial ciliary action, which is the first line of defense of the lower respiratory tract. Smoking also irritates the mucous cells of the bronchi and inhibits the function of alveolar macrophage scavenger cells. The patient is instructed to avoid stress, fatigue, sudden changes in temperature, and excessive alcohol intake, all of which lower resistance to pneumonia. The nurse reviews with the patient the principles of adequate nutrition and rest because one episode of pneumonia may make the patient susceptible to recurring respiratory tract infection. Continuing care. Patients who are severely debilitated or who cannot care for themselves may require referral for home care. During home visits, the nurse assesses the patient's physical status, monitors for complications, assesses the home environment, and reinforces previous teaching. The nurse encourages the patient to obtain an influenza vaccine at the prescribed times. Evaluation. Expected patient outcomes are demonstrates improved airway patency as evidenced by adequate oxygenation by pulse oximetry or arterial blood gas analysis, normal temperature, normal breath sounds, and effective coughing. Second one, rests and conserves energy by limiting activities and remaining in bed while symptomatic and slowly increasing activities. Third one, maintains adequate hydration as evidenced by adequate fluid intake and urine output and normal skin turgor. Fourth one, consumes adequate dietary intake as evidenced by maintenance or increase in body weight without excess fluid gain. Fifth one, states explanation for management strategies. Sixth one, complies with management strategies. Seventh one, exhibits no complications. Has normal vital signs, pulse oximetry and arterial blood gas measurements. Reports productive cough and diminishes over time. Has absence of signs and symptoms of shock, respiratory failure or pleural effusion. Remains oriented and aware of surroundings. Maintain or increase weight. Complies with treatment protocol and prevention strategies. Thank you.